Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, Managing Gut Health and Challenges, is presented by Evelyn Minolfo. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or chat for comments. We will try to get through all questions at the end of the presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups or other resources, or for additional dates and times, please call 1-844-472-8499. I'm now going to turn it over to Evelyn.
So you're all here to see and learn about managing and supporting gut health. I think that's a topic most of us could relate to. We've suffered from something at one point in our life. So I'm hoping that this will help you and or loved ones. All right, so in this presentation, you will learn about Basic Nutrition 101 to support your health and gut, GI tract discomfort, signs, symptoms, and possible causes, tips to help you feel better. What is gastroesophageal reflux disease? What is diverticulitis? What is irritable bowel syndrome and irritable bowel disease? Autoimmune diseases affecting the GI tract, which are the two categories of Crohn's disease and ulcerative colitis, and then celiac disease, which is also an autoimmune disease. You're going to learn about the FODMAP diet and gluten-free diets, and you're going to learn about what gluten intolerance is. So you can see here on this chart, this little Venn diagram here, gut health, right? So it's actually a whole body approach when we have gut flare-ups here, the top circle, right? Mental health. So our mental health and our stress and our emotional feelings actually do play into our gut health, and you'll learn more about that during this presentation. Our metabolic health certainly plays a part, as well as our immune health, which also plays a part. So it's the whole body, the holistic approach. It all plays a part in our gut health and how we're feeling. Okay, so the GI tract, the gastrointestinal tract, what is it exactly? So you can see here in this diagram, it's from the mouth all the way down to the anus. So it's the pathway by which food enters the body and solid wastes are expelled. So the GI tract includes the mouth, the pharynx or throat, means the same thing, esophagus, stomach, small intestine, large intestine, and anus. So this can all be affected. Okay, so let's talk about Basic Nutrition 101 to support our gut health and really our overall health. So I like these two diagrams of the plates. We have the myplate.gov, and then we also have the Harvard School of Public Medicine's healthy eating plate. And they are basically the same with the exception of the healthy eating plate. Let's see here. If you can see, this one doesn't have dairy. So, and I like to include it because some people can't tolerate it or avoid it or have an allergy. It's up to you, whatever you're comfortable with. But both plates really are good guides to follow. You can see on both plates, half of the plate is mostly vegetables and some fruit, super healthy and super important, and you're going to learn why. And then the other half, a quarter is healthy protein or lean protein, and the other quarter is a grain. And we do like to emphasize, try to make at least half your grains whole grain. Drink plenty of water and stay active. All right, so let's talk about making half your plate vegetables and fruit. So these are some examples. The more veggies, the better. They are actually anti-inflammatory and nature's medicine. They bring down inflammation in your body. So chronic disease is inflammation. So we want to support our health and feeling better by bringing down the inflammation in our body by eating what we call an anti-inflammatory diet, which is consisting of a lot of plant foods, fruits, vegetables, whole grains. All right. So if you're experiencing GI flare-ups, gastrointestinal flare-ups, at that time, you may want to consider cooked veggies instead of a lot of raw veggies, because that's going to be easier on your digestive system while you're having a flare-up. You can also remove seeds and skins on these fruits and vegetables to help avoid GI irritation, because they can cause an irritation if you're prone to irritation or having a flare-up. So just be careful with that. Soups are also a super great way to enjoy cooked veggies as well, and really good for you, and it's easy on the digestive system. So make most of your grains whole, as we had said before, because you'll be benefiting from that super healthy fiber and antioxidants. And herbs and spices actually are little powerhouses as well, because they are concentrated antioxidants as well, and they also add flavor. So you can do that. When we talk about IBS and IBD, we do want to avoid spicy foods because we want to avoid flare-ups. When adding more vegetables, fruit, and whole grains into your diet, more plant foods, please remember to start gradually, because you don't want to go from all or nothing, right? Because believe me, your digestive system is not going to be happy if you go from not eating a lot of fiber to eating a lot of fiber. You've got to do it gradually. And examples are maybe just adding one vegetable and one fruit serving a day more than what you're doing for a few weeks, and then add another. Do it gradually so your digestive system has a chance to get used to it. All right, and by doing so, you're going to avoid and minimize bloating, gas, cramping, and abdominal discomfort. And remember to drink plenty of water when you're doing this, because it's going to also help aid the digestion of fiber. All right, so again, plant foods, super good for us. They have fiber, they have soluble fiber and insoluble fiber, and you're going to learn about that in just a second. So here, if you look on the chart on the right, soluble fiber in the left-hand column, we've got oats, we've got nuts, we've got beans, and we've also got some peas and apples and pears. All right. And soluble fiber is actually also potatoes have soluble fiber, applesauce, and bananas. And it actually is, they call it soluble because it actually, once you eat it, it absorbs the fluids, and it actually turns like into a gel. So that's really super important to help manage our cholesterol. It will help to absorb the unhealthy fats in our body. And on the right, we have insoluble fiber. And insoluble fiber, think about the brush, right? If you're brushing your teeth or you're scrubbing something clean, the insoluble fiber will actually help to clean out your gut and your blood vessels, and help remove some of those unhealthy fats and plaques. So that's the difference. Now, insoluble fiber, because it is insoluble and it doesn't break down in our gut, and it's like a brush, you just want to be careful again with the insoluble fiber. If you're having IBS, IBD, diverticulitis, you want to take it easy on the insoluble fiber until those flare-ups resolve and you're feeling better, because that may activate it a little more. So just be mindful, listen to your body, see how you feel when you're going about increasing fiber. So on the right side of the insoluble fiber, we've got whole grains, we've got vegetables and fruit, we have leafy green vegetables. Right. Is anything else down here? And some brands, right? Wheat bran, oat bran for insoluble fiber. So like we said, we've got vegetables, fruit, whole grains, and some nuts and seeds are super great sources of fiber. In the case of IBS, IBD, and diverticulosis, Please also be mindful of your portions of nuts and seeds, right? Because that may activate it if you're eating a lot of them. Can also get in the pockets of diverticulosis, and we'll talk about that in a second. So just be mindful of those, and in some cases, you may feel like you need to avoid them if you're feeling a flare-up. And again, this is just temporary, just until your symptoms resolve, but eat these things mindfully. So plant foods also support healthy weight management and fight chronic disease, right? So plant foods, you can't go wrong. It's a win-win. They also balance your blood sugar levels, boost energy, and your mood. They also provide vitamins, minerals, phytonutrients, and prebiotic fiber to supply food for healthy gut bacteria and microbiome. So I'm going to explain that to you in just a second. So the fiber in these plant foods, right, from the soluble, the insoluble fiber, they break down in our gut now to what we call a prebiotic. So now that they're broken down in our gut, this broken down fiber is actually healthy food to feed our gut flora. So and again, when we're newborns, we're born with billions of colonies of healthy gut bacteria and healthy gut flora. So what happens in life, right? We get infections, we go on antibiotics, or we're not eating a healthy diet, and or both, and all those healthy gut bacteria are dying. We don't have a lot of them. So that can negatively impact our microbiome, and our microbiome is the environment of our gut bacteria. So that's why, you want to feed your microbiome healthy foods, which are the plant foods and the fiber that breaks down. That's what a prebiotic is. And I get that question a lot when I do classes and webinars. What is a prebiotic? And a prebiotic is a plant food fiber that once it's in our gut will feed the healthy bacteria in our gut. So so we talked a little bit about prebiotics, so let's talk about probiotics. Probiotics are super good for us because that is the healthy bacteria. And we can get those sources from food sources, fermented food sources, like, or cultured food sources like yogurt, kefir, sauerkraut, miso, and kombucha. And we can also take probiotic supplements to support our gut as well. All right, so good gut health actually supports our immunity. Actually, that's our first line of defense, a healthy gut. Again, now that you guys know, our gut has got billions of colonies of hopefully healthy bacteria. And so if we ingest a germ, a virus, something that is going to negatively impact our health and it goes into our gut, well, our gut will, the healthy bacteria, the stomach acid will destroy and kill it. So you want a healthy gut. Also, 80% of our immune cells are found in the gut, right? So we really want a healthy gut. We want to keep our immunity strong, especially since we've all been through this pandemic, right? We really want to keep a strong immunity. So like we were saying, we have our own unique population of microbes or bacteria in our gut. We know that that's the microbiome, the good bacteria, and that fights invaders and maintains our health. It supports our immunity. And actually, science has shown a link in between an imbalance in our microbiome and health issues. So, and the integrity of our gut lining too. So if we don't have a healthy microbiome, the integrity of our gut lining may not be intact. So it's super important to eat right. Food really is my medicine here. All right, so let's talk about factors that may negatively affect GI tract. Believe it or not, and probably a lot of you know this already, just from knowing yourself, mental and emotional stress that we all can carry either from the past or present, that can negatively affect our GI tract. And we call that the brain-gut connection. And a big part of that reason also is the largest nerve in our body called the vagus nerve. It actually, it's a large nerve part of our nervous system that starts from our large intestine, our lower large intestine, and moves all the way up to our brain, right? So doesn't that make sense? That if we're upset, that will definitely affect our gut and our gut health and how we feel. All right, as well as poor diet and foods that irritate the GI. We all have foods that irritate, our stomach, our gastrointestinal tract. So this is why it's super important to be your own detective. Pay attention to how you feel after you eat something. If you're eating a food and this is making you not feel good and your stomach hurt, and then some people tell me their stomach hurts and then they get a headache. Well, that's the brain gut connection. Just pay attention, be your own detective. Okay, so as well as a poor diet and how if we're upset, alcohol, smoking, drug use, and certain medications and their side effects can also negatively affect our GI tract. So again, pay attention. Environment, exposure to toxins and chemicals can affect it. Sedentary lifestyle, right? Being a couch potato, oh my gosh, that's negatively impacts our health all around, not only our gut health, but our heart health. So it's super important to stay active. Not getting enough sleep, right? Well, we know that that can also negatively impact our overall health. So you have to make sure you're going to get enough sleep. And genetics, right? I mean, we are half of our mother and half of our father. And if they've got health issues, chances are genetically we may have them as well. But the good news is we can overcome them, right, with a healthy lifestyle and a healthy diet. All right, so let's go into GERD, gastroesophageal reflux disease, right, or gastroesophageal reflux. And I think most of us have experienced that, that acidy feeling. Example, if somebody's eating pizza late at night and then they go to sleep, right, that tomato is acidy food, you could end up with GERD while you're sleeping or in the morning. So this happens when stomach acid flows back into the esophagus. If an individual experiences persistent acid reflux that occurs more than twice a week, and they go to the doctor about it, the doctor may diagnose that as GERD, right? Gastroesophageal reflux disease. So in GERD, acids in the esophagus cause heartburn and other symptoms, as well as possible tissue damage. So you really don't want to have this going on chronically for years because it does cause damage. So causes can be obesity or overweight due to increased pressure on the abdomen, certain medications, including some asthma medications, calcium channel blockers, antihistamines, sedatives, and antidepressant. Smoking can cause it. Even heavy exposure to secondhand smoke can cause it. And pregnancy. Many of you who've been pregnant can probably attest to that. All right, so let's talk about some of the signs and symptoms of GERD. Let's see here. So common symptoms of GERD include here on the right, heartburn, usually after eating, which might be worse at night, chest pain, nausea, bloating, gas and belching, certain food intolerances, difficulty swallowing, regurgitation of food or sour liquid, sensation of a lump in your throat, disrupted sleep, chronic cough, new or worsening asthma, laryngitis. So wow, that really causes a whole battery of symptoms that are not fun, that can really help make people could really suffer from it. So really pay attention to that. So the good news again is lifestyle modifications can really improve the symptoms or really help to cure the symptoms, hopefully. So losing weight for people who are overweight or had a recent weight gain will help tremendously. Avoid eating very large meals. Instead, eat smaller meals more frequently. Eat in a relaxed environment, eating in a stressful environment and just eating quickly. Some of us do that at lunch. That is not good. That can cause some GERD symptoms. Finish eating 2 to 3 hours before going to bed, right? Because we were saying you're eating something and it's acidy, and then you go right to bed, most likely you could have GERD. So try to avoid doing that finish eating 2 to 3 hours before going to bed. Quit or avoid smoking, huge. As we know, smoking will cause GERD or can cause GERD. Minimize wearing tight clothing around the abdomen. Tight clothing around the belly can do it. And what's very helpful is if you sleep at a slight angle with the head slightly elevated. Some people who suffer from chronic GERD are told to elevate the back of their bed, put the back board up, blocks on the back to elevate it, and that super helps a lot as too. Now, modify diet. You can modify your diet to avoid triggers such as chocolate, alcohol, acidic foods like tomatoes and citrus fruit, coffee, other caffeine sources, and spicy foods. Again, be your own detective. Pay attention to how you feel after you eat something. And if it's triggering it, you can make a modification to prevent it. All right, so let's talk about irritable bowel syndrome. That is so super common with a lot of people. I'm sure some of you watching this will relate to this and say, okay, that's me. So it's actually a very common digestive disorder that leads to the onset of several symptoms like recurrent abdominal pain, cramping, gas, bloating, as well as bouts of diarrhea and constipation. So the exact cause of irritable bowel syndrome is not very clear, but it can be triggered by a variety of factors. Since symptoms vary from person to person, the treatment for IBS should be fine-tuned according to each individual patient. And again, this is where it's super important to be your own detective. So the goal of treatment is to ease digestive distress and reduce flare-ups rather than curing the condition itself. So let's look here on the right diagram here for possible causes of irritable bowel syndrome. So we know diet, spicy foods. If you're not eating healthy, if you're eating fried foods or foods that because now you're being your own detective, that can trigger something, or an intolerance to a food item. Some of us have food intolerances to certain foods, so watch those. Again, mental ailments, emotional stress, right? That can certainly cause it, and we understand why now. And then infections, that could do it, or GI motor problems. If for whatever reason your GI is either slowed down or you're eating something that's causing it to work too fast. All of these factors can contribute to IBS. All right, so let's talk about diverticulosis, diverticulitis. So they actually are small bulging sacs or pouches that form on the inner wall of the lower part of the large intestine or the colon. It's super, super common, unfortunately, in the US. It is found in more than half of Americans over 50. So science has found a correlation between societies in modern Western worlds and high correlation of diverticulitis. So for example, the standard American diet, the SAD diet, which is eating a low fiber diet long-term, has been correlated around the world. Again, modern Western societies that eat this way all have a much higher prevalence of diverticulitis. Now, the diverticulitis, itis meaning inflammation, that occurs when these pouches become inflamed or infected, right? So those who have it, you probably notice a correlation between that and something you ate. So if you know you have diverticular disease, watch out for portions of nuts, seeds, corn, and peels, and foods that can get, if you look into this little picture here of diverticulosis, you can see how these things can get caught in the pockets. And then they cause a flare up and they can get infected. And with those who get it, it's super painful. You really want to try to avoid it. Alcohol, fried, sugary, and excessive gassy foods may also cause a flare up. So be super careful with that. Be mindful and make sure you're drinking a lot of water to help move all that through. All right. So what can we do about diverticulosis if we have it and we've suffered from the diverticulitis? Exercising, controlling your weight, eating less red meat and more fiber consistently may help. Consistent fiber reduces the risk of both developing diverticula and getting symptoms if you already have it. When experiencing flare-ups, however, please avoid those high fiber foods, okay, until the flare-ups resolve, because the high fiber foods may just aggravate it more. So be careful when you're experiencing, just let up on that. Drink a lot of water, soup, no spicy foods, just go easy until it resolves. But we do know, again, to stay healthy and avoid flare-ups, when we're feeling okay, adults should get 25 to 30 grams of dietary fiber every day from foods such as vegetables, fruits, whole grains, and legumes. A fiber supplement may also help manage the disease, and the fiber supplements are usually like the Citrussil and Fibercon, and that actually is made with psyllium, which is a soluble fiber, and that will help keep your colon intact and healthy and support it. Also, please remember to drink at least 6 to 8 glasses of water a day. That will help your gut stay healthy too. And again, as we said, add fiber to your diet slowly, since you may experience gas and bloating if you increase your fiber intake too fast. We don't want that. All right, let's talk about irritable bowel disease now. So we know what IBS is. So irritable bowel disease, IBD, is actually an autoimmune disorder that causes chronic inflammation throughout all or part of the GI tract. Autoimmune disorder happens when the immune system attacks the body's own tissues and organs. So if you just look to the right here and we see the diagram, well, what contributes to IBD? Part of this circle is inherited genes. There may be a genetic component there. An environmental trigger. I remember I was working in the hospital and we had somebody come in with a severe IBD attack. He had come from China, and the environmental triggers there, the emissions, he was exposed to chemicals there, and he had a severe attack. So, cigarettes, unhealthy food, chemicals, that can also contribute, environmental factors, and the immune system. So if the immune system has got some issues and is weakening for whatever reason, that can make us more vulnerable as well. All right. So there are 2 categories of IBD: Crohn's disease and ulcerative colitis. So CD being Crohn's disease, UC being ulcerative colitis. It actually can affect as many as 1.6 million Americans. Most are diagnosed before they're age 35. So although sufferers experience many of the same symptoms, the differentiating factor between ulcerative colitis and Crohn's disease is where in the body it strikes. So Crohn's symptoms can manifest in any portion of the GI tract, and you guys remember that diagram. That's like from the mouth all the way down to the end of the GI tract. And UC, ulcerative colitis, will just affect the colon area. So you can see a picture here on the right. Crohn's disease can affect any part of the digestive tract, and ulcerative colitis is to the lower part of the digestive tract. So what are the symptoms? Abdominal pain, diarrhea, sometimes with blood, incontinence or urgency to use the restroom, rectal bleeding, weight loss, fever, anemia, and malnutrition and delayed growth in individuals who developed the condition very young and were undiagnosed. So this is pretty serious stuff here. So you see ulcerative colitis and Crohn's disease. You can reduce and address symptoms with a variety of therapies. So that's the good news. So goals include reducing and/or stopping flare-ups and healing inflammation. So irritable bowel disease treatments may include medication and a range of diet and lifestyle changes that help reduce inflammation and support the immune system. So IBD often causes issues in different parts of the body, and cases vary. So in some cases, a multi-specialty approach for care can be super helpful. So for examples, somebody suffering may need to see the gastroenterologist, the rheumatologist, because some arthritis can occur, dermatology, they may have some skin issues from it, a dietitian who can support them in eating to lower symptoms, ophthalmology, it can affect the eyes, and lastly, surgery if need be. And all can work together to improve quality of life. So again, let's look at this diagram here on the right? So lifestyle to manage symptoms. It's so about that, right? It's so about the holistic person. So on the top, right, we're going to just talk about your purpose-driven living, your why, what makes you happy, what gives you purpose, right? That's huge. I mean, if you're feeling good about your life and yourself, that positive attitude is just going to help you do what you need to do to get the help you need and to have a healthy lifestyle. And then if we go down here, physical activity, huge. It's going to help support you through this. Nutrition, huge, very, very important. And again, like I have said through this presentation, be your own detective. Pay attention to the foods that you think may be triggering it. Make sure you're eating a healthy diet to support you through this. Sleep is huge. Got to make sure you're getting enough sleep. Stress management and mental and behavioral health, they all contribute to feeling better and managing symptoms, right? And then on the left, you got to make sure you stay hydrated. You manage your stress, exercise, quit smoking if you smoke, avoid alcohol, be mindful of that, monitor your diet, keep up with your doctor's appointments, and enjoy a balanced lifestyle, doing activities you enjoy. Huge, really huge. Keep a positive mental attitude. Okay, so for irritable bowel syndrome and irritable bowel disease, let's talk about dietary modifications because that's huge and that can really make or break how you're feeling. So, like we said, be your own detective. Certain foods may have an effect on symptoms. Keeping a food diary can really help you track when symptoms improve or worsen with the foods you eat. So that's important. About half of people with IBS and IBD are lactose intolerant as well. So if that's you, avoid foods with lactose. So the cow's milk and the soft cheeses. The aged hard cheeses like cheddar, Swiss, and Parmesan, the good news is they lose their lactose during the aging process and do not contain lactose. So you can have those. So just be careful when you're eating these foods, see how you feel, do them gradually. There's also a plethora of lactate-free dairy products like lactate-free cow's milk. I've seen lactate-free cottage cheese, lactose-free ice cream. So you do have options, but again, just be mindful when you're trying them, all right? And go easy and gradually to make sure you're okay. So omega-3 fats are also super good for you, right? They're anti-inflammatory. They are found in the oily fish and in fish oil and krill oil supplements, also in some plant foods like flax and walnuts. They can decrease inflammation, omega-3 fats, and also please cut back on foods high in omega-6 fats. So omega-6 fats are pro-inflammatory fats. And we actually, with the way we eat in this country, we're actually getting more omega-6 fats as opposed to omega-3. And that's why so many of us have inflammation now. And that's the omega-6 are in snack foods, processed foods, junk foods, red meats, and fried foods. So be mindful of that as well. All right. So IBS, IBD, what recently has been proven to be super effective to help people who suffer from this is a dietary modification called the FODMAP diet. So that's like a funny, crazy name, right? And you're gonna be experts in this by the end of this presentation. So FODMAPs, and that's a acronym, and you'll learn what that acronym means in a second. But these foods contain naturally occurring carbohydrates and sugar molecules in these plant foods that may be hard to digest and may trigger symptoms. So knowing the FODMAP's foods and noting your response to these can determine foods you may need to avoid. You can try this approach on your own and/or with a dietitian. Also, certain hard to absorb sugar alcohol sweeteners such as sorbitol can worsen IBD symptoms. Also, if you can avoid alcohol and caffeine, as that may be a trigger. So here, I'm just going to look, I want you to look at this diagram. So health benefits of a low FODMAP diet. So the FODMAP foods may trigger symptoms. So if you're on a low FODMAP diet, you're going to benefit from less triggers. So, and this has been shown to really help. GI doctors know about this and are using them now. So this diet manages gut disorders like irritable bowel syndrome, IBD, irritable inflammatory bowel disease, small intestine bacterial overgrowth. Some of you may have heard it, some of you may have had it, gluten sensitivity, and abdominal discomfort. So alleviate the GI symptoms like bloating, flatulence, cramps, and improve stool consistency. So this is pretty exciting stuff. Okay, so FODMAP foods, it's the acronym for, and unless you have like a PhD in food science, it's not going to make sense, but it's the name for these starch and sugar molecules: fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Again, these are types of carbohydrates, sugars, and starches in foods. For some, these plant foods are not a problem unless eaten in large amounts. However, some individuals may be sensitive to these foods with FODMAPs in them. Reason being, FODMAPs foods can draw water into the digestive tract, causing bloating. It can stay in the gut, ferment, and once it ferments, it can cause gas and abdominal pain. So again, a diet low in FODMAPs can help improve and manage these symptoms. Okay, so let's talk about the FODMAP food categories. So we've got the fructose category. So some fruits have this fructose that may aggravate your symptoms. I'm going to talk about that in a second, as well as the fructose, right? Honey, high fructose corn syrup, and agave sweetener. Lactose, lactose in certain dairy foods. Fructans, which is in wheat, barley, and rye. So people who suffer are advised to try a gluten-free diet. As well, there's onions and garlic as well that can aggravate it from the fructans. Galactans, so foods that contain galactans can be legumes such as beans and soybeans. And polyols, sugar alcohols that are naturally occurring in some fruits such as apples, avocados, figs, dates, and stone fruits such as cherries, peaches, and plums. All right, so those are the categories. So now let's talk about the food lists from these categories. So the veggies and legumes category. So high FODMAP foods include garlic, onions, asparagus, beans, soy, cauliflower, beets, broccoli, cabbage, mushrooms, peas, and scallions, the white part of the scallion, the green part's okay. In the fruit category, high FODMAP foods are apples, pears, avocados, blackberries, grapefruit, mango, raisins, watermelon, and stone fruit, such as peaches, plums, apricot, and cherries. All right, grains and bread category. Again, these are high FODMAP foods: barley, spelt, bran, wheat food. So example, bread, cereal, pasta, couscous, gnocchi, granola, muffins, rye, and semolina. And in the nut category, high FODMAP foods are cashews and pistachio. Okay, so let's talk about additional high FODMAP foods in the milk category: cow's milk, goats and sheep milk, soft cheeses, and soy milk. Dairy category, again, buttermilk, custard, yogurt, ice cream, sour cream, and regatta cheese. In the sweeteners category, agave, high fructose corn syrup, honey, and some sugar alcohols like mannitol, sorbitol, and xylitol. The drink category, apple, pear, and mango juice, sodas with high fructose corn syrup, fennel, and chamomile tea. So these are all high FODMAP foods that if you're suffering from any of the disorders we talked about, IBS, IBD, this is something that you may want to try because it has shown to be effective. All right, so those are the high FODMAP foods, and those are the foods that you want to avoid if you want to start feeling better. And we have a plan for you to do that. That'll be in the next few slides. You'll see in just a moment. So low FODMAP foods include protein foods, right? So lean meats, poultry, seafood, and eggs, those don't have FODMAPs in them. The fruits that you can have that are low FODMAP are bananas less ripe, blueberries, cantaloupe, grapes, honeydew, kiwi, lemons, limes, oranges, papaya, passion fruit, pineapple, raspberries, rhubarb, strawberries, tangelos. Vegetables: bamboo shoots, bok choy, carrots, celery, chives, cucumber, eggplant, green beans, kale, lettuce, parsnips, pumpkin, radish, red bell pepper, spinach, zucchini, sweet potato, turnip, white potato, zucchini. Again, these are the low FODMAP foods that you can have. So there's still a lot of foods you can have. Dairy, and again, because these are, the kefir is more of a fermented. So kefir, you can have low FODMAP. Lactose-free milk, lactose-free yogurt, lactose-free cottage cheese, hard and aged cheeses are fine. Butter's okay. And cream cheese, but limit cream cheese to 2 tablespoons or less. So those are the low FODMAP foods. Again, low FODMAP food for grains: quinoa, rice, millet, cornmeal, gluten-free grains, and gluten-free products. Legumes and nuts. So firm and medium tofu is fine. That's low FODMAP, as well as canned lentils and canned chickpeas, rinsed and drained, because during the canning process, those FODMAPs leach out. So when you're rinsing and draining them, you're rinsing and draining those away. So you can see if those are would be okay. See how you feel when you eat them. Walnuts, pecans, peanuts, pine nuts, macadamia, Brazil nuts, pumpkin seeds, sesame seeds, and sunflower seeds. So those are all the low FODMAP foods. Beverages: espresso, filtered coffee, green tea, peppermint tea, black tea. Sweeteners: granulated and brown sugar, brown rice syrup, pure maple syrup, corn syrup, not high fructose corn syrup, molasses, aspartame, saccharin, and sucralose, and stevia. So those are all low FODMAP. So again, you can see you have a lot of options for low FODMAP. So 3 steps to a low FODMAP diet. So the low FODMAP diet is a learning process that will help you find which foods make symptoms worse without taking any away that don't, right? Okay, so step number 1, look over the list of high FODMAPs foods, and at the end of the presentation, I have links for you so you could get generate your FODMAPs food list that way if you would like. But look over the list of high FODMAPs foods. If you eat much or of any of them, try cutting them out first, okay? Now, if you do that and you see improvements and you feel better, that may be all you need to do. If not, try to cut out all high FODMAP foods as much as you can for 6 to 8 weeks, all right? Now, step 3, after 6 to 8 weeks of cutting out high FODMAP foods, bring them back in slowly, one at a time. That way, if symptoms get worse, you will know which food caused it, right? So again, be your own detective and keep track. Be mindful. See how you feel with these foods. All right, so let's talk about celiac disease. So we talked about IBS, IBD, you know about the FODMAPs diet. So celiac disease is a serious genetic autoimmune disorder in which the immune system reacts abnormally to gluten, which is a protein found in wheat, rye, and barley. Without a strict lifelong gluten-free diet, inflammation resulting from the immune system overactivity from gluten may cause a wide variety of signs and symptoms involving many parts of the body. So let's look at this middle diagram here of the intestine, right? So Celiac is a digestive disorder that damages the small intestine, triggered by eating foods containing gluten when you have celiac disease. So here's the small intestine in the middle. Now, some of you might have heard of these little finger-like projections that line our small intestine called villi. So what happens when we have celiac is the villi actually get diseased and they get inflamed and they get shortened. So on the left is normal villi. You can see their finger-like projections. And when they're healthy, they absorb the broken down food into your bloodstream. So you get your vitamins and your minerals and your nutrition absorbed for a healthy metabolism. But when you have celiac, in a lot of cases, these are damaged villi, and you can see they're short and they're not able to absorb the minerals and the vitamins and the nutrition that you need. So as a result, now we're going to look in the right-hand column here, and we're going to see top 10 symptoms of celiac disease. So number one is bone loss. So doesn't that make sense? If you're not absorbing your minerals and your calcium and your vitamins, you're going to have bone loss. Number two, anemia. Again, you're not absorbing your minerals, so you can get anemia. 3, liver disease. 4, diarrhea. 5, bloating. 6, canker sores. 7, IBS. 8, constipation. 9, acid reflux. 10, recurrent miscarriages. So contrary to popular belief, researchers have also identified that more than half of patients diagnosed with celiac disease have no traditional celiac symptoms. So that's a little scary too. All right. So again, celiac disease at a glance. 1 in 133 people in the US have celiac. That's approximately 3 million people. Celiac is a serious genetic autoimmune disease. 83% of the people with celiac disease are undiagnosed. If left undiagnosed and untreated, people with celiac are at risk for serious health consequences, such as osteoporosis, anemia, thyroid disease, and even certain cancers. Currently, the only treatment for celiac disease is a strict gluten-free diet. So how is one tested if they think they have celiac disease? Maybe it's in the family, there's a genetic component, somebody is sick and they don't know why. They can get tested. So healthcare professionals must often use serologic tests. These are blood tests that check for antibodies. And then an intestinal biopsy to diagnose celiac disease. So they can actually, with the biopsy, see how the villi look. If serological tests suggest that a patient could have celiac, then the doc will order an intestinal biopsy to confirm the diagnosis. When checking for a celiac diagnosis, the TTG-LGA, which is a blood test for antibodies, this particular one is the test that is preferred, the preferred serological test for most patients. It's called TTG-LGA. All right, so let's talk about a gluten-free diet. Probably most of you know about this, heard about it. Gluten-free has gone mainstream, and that's good news for those who need to follow a gluten-free diet, or they believe they have a gluten sensitivity. I cannot believe the amount of people that come up to me in ShopRite that tell me when they eat gluten bread and pasta, that some of them feel bloated, they're distended. It seems to just be happening more and more. I don't know what's going on with wheat in this country, but becoming more common than ever. So the good news is there's a plethora of gluten-free foods available. So first of all, I want to say most whole foods are naturally gluten-free, right? For example, fruit, veggies, potatoes, plain meats, plain seafood, eggs, plain cheese, dairy, legumes, nuts and seeds, that's all naturally gluten-free, right? Whole foods, naturally gluten-free. There's also a lot of gluten-free grains and many gluten-free products available. Rice, corn, quinoa, millet, oats, buckwheat, even though it says wheat in it, buckwheat is actually gluten-free grain. There's tons of gluten-free breads. There's gluten-free breadcrumbs, gluten-free cereals, gluten-free pasta, gluten-free crackers, gluten-free flours, baking mixes, and gluten-free snacks. So for celiac, people with celiac disease, they must follow a very strict gluten-free diet. And they also must avoid they're so sensitive to gluten, they must avoid cross-contamination from gluten. They even need to have their own toaster or their own toaster oven. Do not share it with the rest of the family. And their plates and utensils need to be well washed before using to make sure they're getting rid of that gluten residue so they don't have the cross contamination. Now, for those who are gluten intolerant or believe they may be gluten intolerant or who want to follow the FODMAP's diet to feel better, celiac obviously is a very serious autoimmune disease, and gluten intolerance is not. So it's gluten. If you're gluten intolerant or you need to avoid gluten, you're not going to typically have the same type of impact on your overall health like those with celiac. So if you think you may have a gluten intolerance and or you want to follow one to feel better if you have IBS or IBD, you can follow a gluten-free diet to see if the symptoms improve, the IBS, the inflammation, and the pain symptoms improve. Some people tell me that when they eat gluten, they have the pain in the gut and even some joint pain and inflammation. So if you believe that this is the cause, again, you got to be your own detective. If you find this is happening when you eat gluten, certainly worth a try to feel better. And there certainly is a lot of products to choose from. All right, so we're finally at the end here, and thank you everybody for following along. I know this is a ton of information. So if you feel you have any of these disorders, don't suffer alone. Get help. Help is available. You can go to your doc, get an exam, tell your doctor your symptoms, write them down so you remember all of them. Doc can refer you to a GI specialist if needed to run testing. There's lots of tests that they can do, a colonoscopy, an endoscopy, biopsy, imaging, and or blood work to help diagnose your condition. Once diagnosed, the doc can refer a specialist and or put together a team specialist to support you. And as we said, a gastroenterologist, a dietitian, a rheumatologist, dermatologist, whatever you may need. So here are the websites. Feel free to check them out about IBS, the Cleveland Clinic, the Crohn's and Colitis Foundation.
So I would like to say thank you for joining us. We kindly ask that you take a few minutes after today's webinar to complete the program survey. The link to the survey has also been added to the chat for your convenience. A special thank you to Evelyn for dedicating your time and your expertise today. If you have additional questions or comments, you can send an email to communityhealth@atlantichealth.org or by calling 1-844-472-8499. That concludes today's webinar. Thank you all so much for joining, and I hope you all have a great day.
Thanks, everybody. Stay well.